Hello, my name is Dusty Worrell, and I work for the Texas Homeless Network. And today I want to go over orientation for SOAR for adults. So, what are the purposes and objectives of today's training? Well, the primary thing is to share information on SSI and SSDI benefits, offer opportunities for community members to get more involved with SOAR, as well as helping individuals getting connected to their SOAR local efforts. The first big question is, what is SOAR? SOAR is a model to help individuals apply for the Social Security Administration's benefits. This could be Social Security income slash, which is SSI, Social Security disability insurance benefits, SSDI. It is typically designed for individuals who are experiencing or at risk of homelessness. So for those who know, it's typically category 1 through 4 would fit the bill there. And they typically must have some form of serious disability. These can take little forms of like serious mental health issues, such as schizophrenia, bipolar type 1, could be co-occurring substance use disorders, so there's alcoholism and maybe depression or PTSD is present. Uh, or the obvious one is physical disabilities. These could range from there from the most severe individuals with the most severe form of cancer and unable to work to someone who has had major injuries that has led to very limited mobility that results in an individual not having some form of gainful employment, which I'll explain gainful employment in a few slides. The other thing about what SOAR is that the Social Security Administration has supported the use of the SOAR model since 2005. So for over 20 years, this model has been endorsed by the Social Security Administration, and all 50 states, including DC, practice it in some way, shape, or form. Every state's a little different. Some states are a little bit more robust with how SOAR is done. Others are more use it if you want to and if you're trained to. Texas is somewhere in the middle. So, but first before we get into more about Social Security, first we need to get into uh, the basics of what SSI and SSDI is. So, as mentioned, SSI is the Supplemental Security Income. This is eligibility based. This is for people with low income, very little resources and living arrangements. So, typically, most individuals experiencing homelessness may qualify for this and typically do qualify for this for at least a period of time. The benefits here are based on a monthly federal benefits amount, which is about $967 for this current year. Uh, Date of eligibility is just whenever the individual applies for it. The protected filing date that's mentioned here is just if you call it Social Security in advance and say, hey, I'm going to apply for these benefits, that will basically say that that's the date that benefits are going to be retroactively started. This also allows for individuals to have health insurance through Medicaid. On the other side, SSDI or Social Security Disability Insurance, eligibility is based on status, on insured status. This is your FICA payment, so you have to have paid into this for a period of time. Monthly amounts are based on earning history, so everyone's going to be a little bit different. Some are going to have a little higher, some are going to have a little less. Date of eligibility is based on date of onset. This could be someone who maybe has date of onset of 5 years ago, but that's technically have been trying to keep jobs, but struggling to. So that on eligibility is back then. Same thing applies though for the protected filing date. If you call Social Security, hey, I'm going to apply for these benefits, the payments if they get approved or the benefits if they get approved will be retroactive to the date of the protected filing date. Insurance here with SSDI is going to be through Medicare. I do want to take a moment to say that people often confuse these two types of benefits. It's very easy. They both are I is in there, and they're very similar. Just remember, SSI is going to be your needs based on income and the resources and living arrangements, where SSDI are for individuals who have a disability that prevents them from having gainful employment. So SSI, SSDI eligibility. Let's talk about the definition of a disability for adults. Um, so typically, within SSA's definition of disability, this is how they define it. A disability is the inability to engage in substantial gainful activity. Um, Sometimes they refer to as substantial gainful employment. It just depends on who you're talking to. Um, but in SSA's eyes, substantial gainful activity slash employment for 2025 would mean earning at least $1,620,000 a month. And that's for this current year of 2025. The previous year in 2024, it was 1,550 a month. So things steadily increased based on, inflation rates, cost of living, things like that. This, though, is if they do not have the ability to do so, it's caused by a medically determined physical or mental impairments. These also would have to have lasted or are expected to last for a continuous period of at least 12 months or could result in death. So again, these are typically your most severe cases. These are, if we use mental health as an example, again, schizophrenia, that's a lifelong condition. PTSD, while it's not technically a lifelong condition, can and usually does affect individuals longer than 12 months. Um, an example of a condition that wouldn't necessarily maybe qualify, but could be severe major depression. That could be something that qualifies, but not for everybody. On the physical health side, we're looking at things that would qualify. It could be, again, severe cancers, some rare cases of medical conditions such as Lewy body's disease, things like that are easily acceptable in there. On top of that, let's talk about, the ones that might not get accepted, which would be like the common cold or flu or chronic flu. People who have chronically get flu every year, they most likely would not qualify for SSDI based off of the definition of what they consider a disability. So SSA has 5-step process to determine disability for adults, called the sequential evaluation. This image here illustrates the SSA's standards for decision that allows for uniformity across the country. The aim is to ensure that accurate disability determinations are made. I want to note that only 2 places applicants may be allowed, which would be step 3 and 5. An application does not necessarily make it through all 5 stages before being denied or approved. And on a side note, serious illness is not equivalent to a severe impairment. For example, a person diagnosed with bipolar disorder may be able to manage his or her illness, complete activities of daily living, have a healthy ongoing relationship, and complete cognitive tasks. Clearly, bipolar disorder is a serious illness, and there are many, maybe at times where it's difficult to manage. However, many people with this disorder function very well and are capable of work. However, if a person does not have a severe impairment, the application will be denied. On the flip side, bipolar can still qualify for a severe impairment under the disability definition of SSA. Everyone's unique, everyone is different. Going back to the sequential evaluation example here for adults. So step 1 is person working at SGA, so substantially gainful activity. Right? They're assessing if someone is already currently employed and making at least $1,620. If it's a yes, it's an automatic denial. It does not move on. If it's a no, excuse me, they ask the question, does the person have a severe impairment? Again, if it's a no, it's a denial. If it's yes, it moves on. Uh, Step three is, does impairment meet or equal the listings? Yes, that typically means approval, not always. Um, and what it means by the listing, these are a list of conditions that SSA typically see as causing substantial uh, disability. And these listings of medical conditions and mental health conditions do not always equate to the same conditions that are in like the DSM, for those of you familiar with the diagnostic manual for mental health. From there, if it's a no, step four, does the impairment allow for past relevant work? Meaning, is this individual still able to take employment? Can they still work? Um, if it's yes, they're going to be denied most likely. If it's no, it moves on to step five. Does impairment allow for any other work? So step four is looking at, does it allow the individual to do the work they've historically been doing? So if I was a construction worker and I got severely injured, they're going to look at it as, does my current disability or injury, chronic injury, is going to allow me to work in the same type of environment or the same type of profession? If it's yes, it will be denied because I can go back to work typically from their perspective. If it's a no, then they start to look at, can I work in other fields to have gainful activity, substantial gainful activity? If it's yes, typically it's a denial, or no, there's an approval. This is a very simplified version of kind of how SSA makes these determinations. So when it comes to using the SOAR model, um, we all who us who work with those experiencing homelessness, we may see an uptick of individuals who want to have SSDI or SSI applications filled out because they feel like they truly do have a disability that results in them not being able to work. Um, and that can overload SOAR caseworkers fairly quickly if everyone on a caseload is trying to have a disability claim, things like that. That being said, there is a decision-making tree that is out there that it can help individuals and agencies make determination on where to prioritize. You know, so some of the basic questions that are asked is, should I complete a SOAR-assisted SSI, SSDI application? The first question there is, does the individual, which could be a child, a youth, or an adult, have a disabling condition? Um, Examples of this, as it's mentioned, shown here. Sorry about the picture quality. I can send it to individuals, the actual decision-making tree if they want it. They should send me an email. But it's asking for one or more serious mental illnesses, medical conditions, and or co-occurring substance use disorder that meets the SSA listing impairments. If it's a no, explore employment support options uh, and other local resources for economic support. Typically, what I do in these situations is we talk about using our local workforce center. They have the opportunity to potentially maybe qualify for vocational rehab. They may have other supports out there for them, such as supportive employment services, that would make them be able to have employment and earn more money than they would get on disability or SSI. If it's a yes, this individual person does have one or more serious conditions. Um, excuse me. Is the individual experiencing a risk of homelessness? So SOAR is really designed for individuals experiencing homelessness. While I will acknowledge there are tons of people who also qualify for disability, SSI or SSDI, who are housed, there's a lot more resources available to them to help fill out these long applications and to help deal with this process. Um, SOAR can work in those situations if someone's already housed, but you should be prioritizing those who are experiencing homelessness or at risk of homelessness. If you're in a program such as a rapid rehousing project and you are working with someone who's been recently housed, SOAR is still a pretty good model to use for them because they're still going to be experiencing things that others may not. So again, here it's a yes, no decision here. If it's a no, the individual has to is stably housed and is not receiving a voucher or rental assistance. And that's the key to what I was saying before. They You can decide also based on if there's a voucher involved, so like a Section 8 slash housing choice voucher, or rental assistance such as permanent supportive housing, rapid rehousing. Those can still make it someone qualified to use SOAR assisted applications. And then from there, if they don't have any of that, use the critical components as outlined in the SOAR model to assist with a quality SSI application, but you wouldn't flag it as SOAR because you would not be doing the full process. It would just be considered a standard disability application. You would help them complete it, but that would be about the end of the support that would be provided compared to what SOAR model would do. If this situation of whether they're animals or not is a yes, then you would use the SOAR model and use all five critical components for assisting the application. Typically, there in here, you would flag the application for SOAR, usually by calling SSA and saying, "Hey, this application is going to be SOAR assisted," but also on the sections if there's additional information, pages of application documents, you would just put on the top SOAR assisted. And then from there, once information is returned, like the disability determination occurs, and whether they get approved or denied the assistance, you would track the progress. So this does mention a little bit about the SOAR critical components, and just to briefly mention them, there are on the right side here of this image. So SOAR critical components uses 5 steps for caseworkers to follow that play a central role in completing and gathering information and applications for SSA and DDS, which is why it helps speed the process along a little bit. So one, the individual SOAR person serves as an applicant's representative. They're able to sign on the applicant's behalf. They're able to, typically they'll receive mail in addition to the applicant receiving the same letters and mail, so the representative can open their versions, can move the process forward. Very helpful in cases of like street outreach where the person doesn't have a stable address. This is very helpful for. The next step would be collecting and submitting medical records. This takes a long process, and in most cases, individuals don't always remember right off the top of their head where they have their medical records, what medical doctors they've seen, what mental health care facilities they've been to, if they have been to any. And this is also a time if you're noticing that there are lacking of medical records to encourage the individual to start seeking medical care or going to medical doctors to build those records up. So when they do get reviewed by DDS, which is the Department of Disability Services, that reviews the medical side of things for SSA, they have at least some records of, okay, this person is going through treatment, being treatment compliant, and they're still having a disability that is preventing them from gaining meaningful employment. Step 3 then is writing and submitting a medical summary report. This, just in brief, this is where the SOAR caseworker will summarize everything they know about the person from what they find in their medical record, their history they've collected, and it's written in a way to explain to talk about how employment is impacted, their daily functioning is impacted, things like that. Step 4 then is obtaining co-signature on the MSR by an accredited medical source. This is encouraged but not required. So if it's a physical health disability, a physical health doctor should review it. If they agree and concur with what the SOAR caseworker has written, they may sign it. And then it goes to what's called a clinical opinion. It has a little bit more weight than just having a SOAR caseworker signature on it. Same thing if it's a mental health, having a psychiatrist sign it is more helpful. It's even more helpful in that scenario than to have a therapist or psychologist sign it. It's better to have a psychiatrist sign it because there's a little bit more weight given behind the medical side of things for the medical signature since medication can be prescribed. On a side note here, if you are a licensed provider through either counseling, substance use, social work, psychology. When you sign it, you would not be able to have it be considered an acceptable medical source because you're the one who's preparing the document. You'd have to have someone else do that for you. And finally, step 5 is completing a quality review of applications prior to submission. This is where you're taking some time to review everything, ensuring that everything was filled out correctly, um, nothing was left out, and then having someone review the medical summary report to make sure it's adequate in quality as well. So I hear this a lot sometimes that who is SOAR for? SOAR is for everyone. It works across the lifespan, meaning from young children all the way to the elderly can qualify and can benefit from SOAR. Uh, this also works with a diverse population. It can work with individuals who are right children, for people aging out of foster care, those who have mental health conditions, those who have substance use conditions. Um, there are those who have worked within complex systems. So this could be someone's in a legal system and they're about to be released from jail, helping them get their process going. As I mentioned, referencing to foster care, that's a big one. Veterans can also utilize it as well. The image here comes from the SAMHSA's SOAR website, TA website. Unfortunately, the TA Center was shut down recently, back in August 16th. The image is still valuable because it shows you kind of the different categories of things that can be worked for. There are links in this photo. I do have those resources. Again, if anyone needs them or have questions about them, then feel free to reach out to me. I'll have my contact information posted at the end of the slides. So SOAR is really a foundation for recovery and resiliency. It's not just to give someone income, some form of income, and they just sit there and do nothing. Um, Even SSI and SSDI is designed to help individuals get back into the workforce and not stay on these assistants forever. Some cases that's inevitable; it has to happen that way. But for most people, it helps them get into the ability to move on and get the treatment they need and get the services they need so they can have gainful employment. Because who doesn't want more money, and two, the money that people do get on this barely covers basic needs, and in most communities, it's not enough to cover rent. As I mentioned, SOAR is more than just income. It provides access to healthcare and housing. This is through Medicaid, Medicare insurance. If the state was an expansion state, a lot of states provide services for housing in that capacity with Medicaid or Medicare. Uh, it also allows for individuals to have increased education and employment opportunities because there are options within uh, those who receive SSI and SSDI to receive additional benefits to help them move into gaining better education and or have employment opportunities. It also allows for decreased incarceration and hospitalization, right? Things to think about, right? They have access to treatment. They now have access to housing. They now have access to numerous things that they probably wouldn't have if they're living in the streets. So SOAR is like the foundation, as the image says, it's a foundation. The benefits help and the insurance help. Then move into the next step, which is that housing piece, which is very important for stability and for individuals to start really being able to treat and address their mental health or physical health conditions in a safe and secure environment. And then it also moves in from there to supporting wellness and long-term recovery. And as mentioned, many individuals may qualify for SSDI while they're out who are on sheltered homelessness and not living out on the streets or in cars because they don't have the ability to take care of themselves like they should or need to have. And then once they get housed, or depending on how the process works, they can sometimes get the defense force before housing, they can get housed and then the defense become active. In either scenario, that allows them to then have that stability piece of, okay, I have housing, I have income now, I can get my basic needs met, I probably have my health insurance now, and they can keep moving forward. So the big question is usually, how do states and communities benefits? Because SOAR does take a while sometimes to do. Um, and the benefits to communities are not always apparent for those who don't work in this space. Um, So SI and Medicaid, so Social Security insurance income, and Medicaid bring federal dollars into state, local communities, and localities, as well as their local programs. Um, Many programs around the state exist for federal grants, state local grants sometimes available for SOAR these workers to provide more care. Um, in many cases, healthcare providers such as your local doctors, private practicing doctors who may be working with homeless shelters who are kind of just offering free services, but they're really not recouping any costs for the uncompensated care, but they have someone who is SSDI qualified or SSI qualified, they can recoup some of that cost through those benefits. Not necessarily being charging the individuals directly, but through charging the insurance company, such as Medicaid or Medicare. Uh, State and local localities can recoup the cost of public assistance. This could be things like hospital care that are being subsidized through the state or local communities. Because again, Medicaid, Medicare comes in and helps offset the cost differences. Um, this also allows the situation is it's usually back pay occurs to where they can recoup lost cost of treating this person several times. Um, Cash benefits for the individual themselves can benefit the community because they get the back pay as well as their continual cash payments, which allows the individual to spend in the local community. They're going to spend a little bit more money, hopefully and ideally within using a budget so they're not spending it all, but they're more likely to reinvest in their local communities. So it's a cyclical process. Helping one person can help the total community as well as programming receive more federal dollars or even state dollars. So what makes this SOAR model unique? Well, as mentioned, it's the SOAR critical components. Um, I know many of us have experience filling out Social Security applications for SSI or SSDI, but that's just more in a supportive capacity, but we weren't the experts on the process or the experts on being able to be like, okay, what do we do next to help expedite the process? It's more of, okay, we filled it out. Sorry, it's going to take 5 to 6 months to complete things to hear back. It's just a waiting game now. Well, SOAR is unique to where it takes that waiting game, that guessing game out, right? You become, as I mentioned, you do become the uh, appointed representative, allowing to make decisions for the individual behalf, which can expedite the process exponentially. You'll already move into step two, right? You're already collecting the medical data and you're submitting the medical records in advance. So it's already ready to go. They don't have to do any little legwork at DDS to get that information, which that's the longest part typically is the record collection. You're also writing and submitting a medical summary report, which summarizes everything, your work with the individual, collateral information from like friends, family, maybe shelter staff or other caseworkers who've worked with them, as well as summarizing the medical records to explain their disability and how it's impacting their functioning, their social skills, their self-care, their ability to have substantially gainful activity, things like that. So it's an easy, quick reference for DDS to reference in there, and then they can quickly reference the material that you reference in there. So they're not like looking through piles of reports and papers that may or may not be relevant. Um, Four, if you are, and we would all strongly encourage this, are able to engage in getting co-signature on medical summary reports through a medical provider, it exponentially puts more weight behind it and is more like the likeliness of success of the application increases quite a bit. And then finally, completing a quality review of the application before submitting. We all review our work, I imagine, even those of us who weren't SOAR trained um, before we submit, but we may not know better to not know. We most likely don't know how to fill out the form correctly or in the more preferred manner to get a quicker response. Things like that. Plus, so all five critical components are significantly more likely to be approved. Um, Again, it varies from person to person and state to state. Texas, we went from having a SOAR approved of about 41%, SOAR assisted applications about 41% approved to over 60% approved from last year to this year alone, which is much higher than the average rate of applications being submitted on without SOAR assistance, which is usually around 25 to 30% acceptance rates on the first attempt. So SOAR is also good because it provides community collaboration. It brings a lot of people to the table who is influent, who the individual themselves, the applicant has already maybe interfaced with or worked with, things like that. SOAR cannot and does not function in a vacuum. It is heavily reliant on our community partners. First and foremost, the Social Security Administration is an essential collaborator. SSA is the federal agency that administers SSI and SSDI benefits. Because SSA is federal, their eligibility rules are the same in every state. SSA makes the non-medical decisions on the claim. Then there's the Disability Determination Services, or DDS, that works in partnership with SSA to make the medical or disability determination. The DDS is often the unknown player in the process, but with SOAR, they're absolutely key because there's a working partnership. You're able to get in contact with the DDS worker and provide assistance if more medical information is needed to help schedule appointments, things like that. It's a close working relationship. The next area would be medical and treatment providers are also extremely important. You will need to have access to assessments, evaluations, medical records, and reports to support the claim. So usually there's close working relationships with medical providers that are willing to work and help these situations out if there needs to be an evaluation or assessment that needs done. It usually does involve partnerships with criminal justice organizations, veteran affairs, employment programs, housing providers, and others. Also help to ensure individuals served by SOAR are receiving comprehensive services and support and that are not your SOAR and that your SOAR program is not operating in a silo. And many of our programs already have these working relationships. So when someone does get SOAR certified and start using the model, they can already lean on the existing community collaborations. Many of these different community partners usually have someone who is SOAR certified embedded in their programs at some capacity, or have experience working with SOAR to help make the process for them easier when providing the assistance to the individual. So the final piece really is SOAR leadership. So SOAR, again, does not function in a vacuum. There's a leadership structure in every state to provide assistance to those who are providing the assistance, if you will. In Texas, ours is a little bit different. So we have the state of Texas does not actually fund SOAR itself. We don't have a department or a program ran by the state of Texas that oversees SOAR. We do have a few state programs that use SOAR as a model, but they don't typically, run the expectations for the whole state and those of us who are SOAR certified. So in the state of Texas, we utilize state leads. Most states have one state lead. To my knowledge, every state currently has a state lead. These are individuals who facilitate, state steering committees. These would be committees that would include SSA, someone from the DDS, maybe someone from the state government or department from the state. It could include major players such as COCs, major hospital systems, things like that. In our state, we have one. It's mostly comprises of DDS, state leads, and the medical system providers, as well as a couple COCs. To take a step back and apologize, I skipped over it, but our state, as I was mentioning, most states have one state leads, but we have three state leads, who I'll introduce later in the slide in our next couple of slides. Because our state is so massive and so diverse. Having just one state lead is too would be overwhelming. So we have currently have three state leads, who also then, as I mentioned, facilitates the state steering committee, provide direct plan that directs the plan to grow and sustain statewide activities. Um, they maintain the overall working relationship with SSA and DDS. We maintain outcome tracking processes as well as facilitate any of the training needs that are needed. Um, Local leads, now these are the individuals who most SOAR caseworkers work with maybe on a daily basis or on a monthly basis. These are individuals who direct the local implementation plans. Like how do we, typically that would look like, how do we bring the local hospital or the local jail or the local mental health authority into the conversation and expanding SOAR access at our local level. Um, this provides assistance. They also provide assistance to SOAR certified case managers to help fill out applications. They do conduct some training, but it's typically more review training. They don't do like the certification process. They also ensure quality applications and report outcomes. So local leads gather the outcomes, and while state leads maintain the tracking process and all of that. Local leads, like as I mentioned, can be utilized to help do those reviews of your medical summary report and your application before they get submitted. And then finally, you have your SOAR certified case managers. These are the individuals who are typically performing, who complete the high quality SSI, SSDI applications within the SOAR, with using SOAR. They communicate directly with a local SSA office or DDS representatives throughout the process of the application, and then they also track outcomes. So next steps, and as I mentioned, I would talk about who our three state leads are. So next steps for our state is reach out to your local or state leads. Currently, our state leads are myself, Dusty Worrell, LaShandrea Dwyer, and Layla Hernandez. We're all three are the state leads at this time. I'm also function as the Texas Balance Estate COC local lead. So everyone in that area can reach out. Really, anyone across the street can reach out to me. Anyone can reach out to the other two as well for questions and trainings. Have questions, things like that. Hey, we need funding assistance because we want to go ahead and fund a position. You can reach out to us and we can try and provide some assistance and point you in the right direction for funding assistance because there are grants out there. For caseworkers who are already SOAR certified, you can reach out to us for assistance and request more training, things like that. I know with the SOAR TA Center having closed recently, it kind of makes things a little bit more complicated. All three of us have all the worksheets and extra documents that were available on the SAMHSA's SOAR TA Center website. We were more than willing to share it. There will be more information to come for those who are already SOAR certified on kind of where we're going to house all these long term, and also how we're going to provide the tracking assistance for outcomes. For those of you who are program managers or agency leadership and you want to learn more about SOAR than what was discussed today, feel free to reach out to all three of us or any one of us. We can provide a little bit more in-depth conversation, talk about how SOAR might be able to be implemented in your agency, even if it's not having a SOAR dedicated position, but maybe having a SOAR certified staff who does one or two SOAR applications a year. We're willing to have that conversation. There is this contact information here, which is the Texas BOSCOC at thn.org email. This goes to the planning team here at THN. Feel free to shoot us an email if you have questions about how SOAR relates to homelessness or how SOAR is integrated into COC or ESG programs. We have a lot of great resources out there on that. And if you have just general questions about that stuff in general, we may be able to help have that answered as well, or point you in the right direction who you can ask. I want to thank you all for watching this. this video. Again, if you have any questions, please reach out to the three state leads or the local lead for the Texas Balance Estate, COC, or reach out to the planning team with the email here. Thank you.